My husband and I met when I was only 16. He was in the service.
Come down and see Paulette on our weekend passes, and we kind of dated for about 3 or 4 years before I asked her.
We have 3 children. They are a couple of years apart.
She's great mom, great grandma.
I started having what I thought was heartburn. I would feel it right in the middle of my chest. The day of the heart attack, it didn't go away.
She came in and woke me up and said, you're gonna have to take me to the hospital.
I knew that it was something more than just heartburn, and I was scared. And that's when I said, well, I think we better call 911.
They were there very quickly, and thank God they were, because if I would have drove her, she wouldn't be here.
Once I got to the hospital and they called the cath lab to tell them I was coming, I knew that it was going to be something serious.
She just had 100% blockage, and then there was another artery behind, was about 85%.
She had a cardiac arrest while in the ambulance about 5 minutes from the hospital. She didn't go to the normal hospital or the closest hospital because they didn't have cardiac interventional services. They don't do cardiac stents.
And I went in to see her, and we held hands, talked a minute. Just kind of reminiscing of some of the things that, that we did together for years. And just, thinking about what would have happened if she wasn't here.
Miss Brooks had typical symptoms, but a lot of times women don't. Women have atypical chest discomfort, they have shortness of breath, they have fatigue, they have lightheadedness, they get nausea. So women present differently.
Prior to my heart attack, I had been going back and forth to my doctor for my cholesterol and my blood pressure. It's hereditary, evidently, because my mom had high blood pressure, my brother had a heart attack.
Stress test can be negative because if you have blockages in all 3 blood vessels, the test doesn't see it. The test has to see a difference in the blood flow to the heart, and if it doesn't see that difference, it's because sometimes all 3 are blocked.
If you think it doesn't feel right, don't be afraid to call 911.
It's really important for women to recognize their symptoms, and if they don't know what's going on, to ask help. And once they have an established diagnosis, if they have heart disease, they should tell their friends, their loved ones, what they experience.
I hope that my children heed what happened to me and take care of their health so that they can live to be at least as old as I am.